city of West Hollywood, we have one of our residents, a 33-year-old lawyer who's currently in a coma at Cedars-Sinai with meningitis on life support. And we don't know at this point whether or not this particular strain of the virus is related to the virus that seems to have erupted in New York City, where New York City has 22 cases of meningitis, 7 fatalities in the city of New York. These incidents seem to be prevalent among sexually active gay and bisexual men and men who have sex with men. Here in the city of West Hollywood, obviously, we have a very large number of gay men in our city and our community. We're very concerned that 2 weeks ago, the White Party in Palm Springs gathered about 8,000 to 10,000 gay men in the city of Palm Springs, including from New York. This particular resident was in attendance at the White Party. We don't know yet if we can make that connection between the individuals who were present at the White Party and our resident. We're not releasing his name at this moment because the entire family has not been notified of his condition. We're seriously concerned, of course, because every weekend in the city of West Hollywood we host in the neighborhood of 200,000 LGBT people in this city who come here for our nightclubs and nightlife. So we want to place the community on high alert that we may have an issue. We're letting people know if you are suffering from the following symptoms: high fever, severe headaches, nausea and vomiting, a stiff neck, that you immediately go see a physician. Meningitis is treatable if it's caught early. This particular strain, if there is no intervention, there is a possibility of severe brain damage and possibly being fatal as well. I think what we've learned, the history of HIV and AIDS, is that we did not sound the alarms early enough as a national community, and there was a catastrophic event that followed and has been with us ever since. So this year, we're going to play it safe rather than sorry. We don't want to create panic in the community, but at the same time, we want to alert people that this exists and to be on the lookout for these particular symptoms and to see a physician if you exhibit any of these symptoms. So we're very closely monitoring what's happening. If we start to hear that there is another case or another case, we'll be right back on the phone with Dr. Liggins to say, okay, now if we have 2 or 3 cases in the West Hollywood community, are we at an outbreak yet? And we're going to be working with our partners at the Gay and Lesbian Center, the pharmacies in town, to make sure that we have, if necessary, enough vaccinations to get it out there to prevent the spread of meningitis. We learned a very tough lesson 30 years ago that we are not going to go through again here in the city of West Hollywood.
So I think the first thing to understand about this particular outbreak in New York City and beyond is that there have been 22 cases of meningococcal meningitis reported since 2010. 22 since 2010. 17 of these cases have been since late 2012. So there seems to be an increase, but it is not a dramatic and rapid increase. The other statistics are as was just reported to you. The thing about infectious diseases that can be spread from person to person in a casual kind of manner by droplet spread from sneezes and coughs and intimate kissing is that when you're in a situation where a lot of people congregate together and have a lot of intimate contact, like the White Party and so forth, then you have the possibility for mixing and matching of a lot of infectious diseases, some of them sexually transmitted, some of them more casually transmitted. The meningococcal organism is one that can be transmitted without having sexual contact. But, again, we're talking about 22 cases since 2010. Not to say that this is not something to be concerned about. It is something to be concerned about because the consequences of an infection can be severe and even fatal. So the first thing that you need to understand is what to do if you are suffering from any kinds of symptoms that may be an indication of an acute meningitis, like John was just saying. And then the next question is, what can you do to prevent such an exposure? The Department of Public Health in New York City has suggested that vaccine is appropriate for all men who have sex with men in New York City. they have, by their definition, an outbreak or an outbreak, which is an increase in the number of cases usually seen. So they are making that recommendation. The County of Los Angeles is not making that recommendation right now, but vaccinations are available for people who feel that they want to take that extra precaution. And if their insurance will cover it, then that's fine. If the insurance doesn't cover it and they want to avail themselves of this vaccine, it would probably be close to $120 to $200 or so for the vaccine. If someone is exposed to an actual case that comes down and gets sick and they have intermittent exposure, then those people should not be treated with vaccine, but with antibiotic medication that can be prescribed. So I think I'm going to stop there because that's an awful lot of information to digest, but that's kind of where things are right now.
So the Los Angeles Gay and Lesbian Center is working very closely with the City of West Hollywood and the Los Angeles County Department of Public Health to address this public health concern, which we want to ensure does not become a public health crisis. It's extremely important that we call upon the county to fully investigate this case, look at all possible spread, do an epidemiologic investigation to make sure that this individual has not come in direct close contact with other individuals who might have been exposed to or get meningitis. It's incredibly important. We are working very closely with the Public Health Department to do that. If a large public health response is needed, this could include a large vaccination campaign, which we would work very closely with the health department to make sure that public health clinics and community health centers that are serving gay, bisexual, and men who have sex with men have ample vaccinations to provide to these individuals. But I do want to emphasize it's very important to make sure to investigate this and do all diligence because a rapid response to this is incredibly important. So the Los Angeles Gay and Lesbian Center on our website, which is lagaycenter.org, has a facts and information sheet about meningitis. And again, we are going to be an eager partner in the rapid response to this public health concern.
We're currently continuing our investigation. We're continuing our laboratory work, and we, at this point, cannot confirm, or we don't know, whether or not this case is related to the cases in New York City. And as Dr. Boland said, last year in LA County, we had about 13 cases of meningococcal disease. And we are currently not having an outbreak in LA County. Obviously, each case of meningitis is very much concerning to us, and we do investigations of each and every individual case. And as confirmed by Dr. Boland, definitely individuals should be on the alert and watch for the symptoms of meningitis. The symptoms of meningitis would be, as Dr. Boland stated, a stiff neck, would be fevers, would be a rash, which can happen some of the times, would be a headache, and would be not feeling well after contact with someone who had meningitis. Currently, our procedure is that we give antibiotics. Antibiotics are what's needed if you've had contact with someone who has meningitis. Obviously, if you have any of these symptoms, we would encourage you to see your medical provider immediately and not just attribute these symptoms to a flu or some other illness. The other one thing I wanted to clarify is that meningococcal meningitis is a bacterial disease. You can get viral meningitis, but meningococcal meningitis is a bacterial disease that's spread from one human being to the other after close personal contact. And close personal contact can happen in social settings where people get together, but mostly it's spread to people who are in closest contact with the person who's infected. And our first line of treatment is antibiotics.